Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. In previous lecture, we continue the infectious disease epidemiology. We see that endemic, what is sporadic, pandemic. Now we see the continuation of that lecture. Today we like to know the episodic. What is episodic? An outbreak or epidemic of disease in an animal population. This is called episodic. And enzootic, an endemic occurring in animals. Anthrax, rabies, brucellosis, bovine tuberculosis, endemic typhus and tick typhus. We would like to know episodic and enzootic because many diseases transmit from animal to man. So, we have to know the episodic, enzootic. Now, we see nosocomial infection. Nosocomial or hospital acquired infection is an infection originating in a patient while in a hospital or other healthcare facility. When patient in hospital or any healthcare facility, then he can acquire some infection from that center. This is called nosocomial infection. Now we see opportunistic infection. This is infection by an organism that takes the opportunity provided by a defect in host defense to infect the host and hence cause disease. For example, opportunistic infection are very common in AIDS. Infection by an organism that is not normally pathogenic but can cause disease if resistance is lowered. Now we go to see iatrogenic or physician-induced disease. Any adverse consequence of a preventive, diagnostic or therapeutic regimen or procedure that causes impairment, handicap, disability or death resulting from a physician's professional activity or from the professional activity of other health professionals. Thus, example, reaction to penicillin and immunizing agents. Childhood leukemia due to prenatal X-rays, hepatitis B following blood transfusion, etc. Now we see what is eradication. Termination of all transmission of infection by extermination of the infectious agent through surveillance and containment. This is called eradication. To date, only one disease has been eradicated, that is smallpox. Now we see what is elimination. It means interruption of transmission of disease, not termination. It means interruption. Example, measles, polio, diphtheria. Now we have to know surveillance. Surveillance has been defined as the continuous scrutiny of the factors that determine the occurrence and distribution of disease and other conditions of ill health. Surveillance is essential for effective control and prevention, continuous scrutiny of health indices, nutritional status, environmental hazards, health practices and other factors that may affect health. There are some types of surveillance like epidemiological surveillance, nutritional surveillance, demographic surveillance and serological surveillance, etc. Now we would like to know investigation of system of an epidemic. Occurrence of an epidemic always signals some significant shift in the existing balance between the agent, host and environment. So we have to know how to investigate the epidemic outbreak. There are some objectives of an epidemic investigation that are to define the magnitude of the epidemic outbreak or involvement in terms of time, place and person. To determine the particular conditions and factors responsible for the occurrence of the epidemic. To identify the cause, sources of infection and modes of transmission to determine measures necessary to control of epidemic and to make recommendations to prevent recurrence. Now we see the steps of epidemiological investigations. First, verification of diagnosis. So, we verify the diagnosis is of epidemic outbreak. Then second step, confirmation of the existence of an epidemic. Third, defining the population at risk, obtaining a map of the area or counting the population. Fourth, rapid search for all cases and their characteristics, such like medical survey, epidemiological case sheet, or searching for more cases. In 5, data analysis by agent host environment model. 6, formulation of hypothesis, and then 7, testing of hypotheses. 8, evaluation of ecological factors. The outbreak can be studied in a case control fashion to know the sources of infection, reservoirs and modes of transmission. 9th step, further investigation of population at risk. This will permit classification of all members as to exposure to specific potential vehicles, whether ill or not. Then writing the report. Thank you everybody.